What's that? You want them to like this video and subscribe to my channel? It's a pretty good idea. Alright, welcome back. This is part 2 of the top 10 chiropractic myths. In this video we're going to cover number 5 all the way through the number 1 most common chiropractic myth. So in the last video we covered number 10 through number 6, and I'll link that right here. We got a lot to cover, so I'm just going to jump right into it. Number 5, the best time to go to a chiropractor is when you're hurt. So in order to answer this question, we need to explain two terms: reactive healthcare and proactive healthcare. I think the best way to explain the difference between reactive healthcare and proactive healthcare is to understand this principle. The human body is always either in a state of illness or in a state of wellness. And the reactive healthcare approach takes the approach of reactively responding to whatever illness, injury, damage, or trauma that happens to the individual and implementing some sort of healthcare remedy to bring them from that state of illness towards the state of wellness. On the other hand, in the proactive healthcare approach, it takes that individual who's in that state of wellness and applies proactive healthcare measures to keep them in that state of wellness. And the cool thing is that chiropractic is uniquely positioned to be great at both reactive healthcare and proactive healthcare. If you get hurt and you go to the chiropractor, that's great. Even though it's a reactive response, there's tons of research and tons of evidence out there that shows that going to a chiropractor when you're hurt is actually one of the best things that you can do to recover from that injury, to get yourself back on track towards that state of wellness. One of the most interesting things is that every NFL team has a chiropractor on their medical staff. Now, if you think about it, they have orthopedic surgeons, they have neurologists, they have medical doctors, they have athletic trainers. They have everything that they could possibly need for reactive measurements. So why have a chiropractor on staff? They don't need another reactive healthcare approach. The reason they have a chiropractor on staff is because they use the chiropractor for proactive approaches more often than they do for reactive approaches. There's a lot of research out there that shows that when an athlete is underneath chiropractic care, their athletic performances increase significantly. And that's a proactive approach because that athlete wasn't injured trying to recover from that injury, going back to their state of normal. They were in an already well-performing state and they got underneath chiropractic care, and proactively it helped them get to that next level. In my previous video, I talked about this research article that showed what would be the repercussions of having a chiropractor be your primary care provider versus having a typical medical doctor be your primary care provider. And what it showed is that not only were your healthcare costs less, but you had far less visits to the hospital, far less pharmaceutical needs, and far less surgeries and outpatient procedures. The reason that I bring that up is because when the chiropractor was the primary care provider, there was far less need for reactive healthcare approaches. So the question is, should you only go to the chiropractor when you get hurt? No, you shouldn't only go to the chiropractor when you get hurt. But if you do get hurt, whether it's a car accident or a sporting injury or whatever it is, it's great to go to your chiropractor as a reactive approach to get you back from that state of illness or injury into a state of wellness. But where chiropractic shines is as that proactive approach to keep you in that state of wellness, to prevent you from slipping back into that state of illness or injury. Because being in that state of wellness, where you're able to prevent most injuries, illnesses, and diseases, allows you to be the highest functioning version of yourself for your family and your community. So number 4, chiropractic is dangerous. Now I was thinking about it. There's a lot of different ways that I can approach this myth. I think the best way to approach it is to look at the numbers. The way you determine whether a healthcare profession or a healthcare specialty is dangerous is to look at their malpractice insurance. So the people who determine malpractice insurance are called actuaries. And actuaries care about one thing and one thing only: data. Insurance companies do their analysis, they look at the historical risk plus claims filed, and they assess the potential for injury. And as the risk for injury increases, malpractice insurance rates increase. So let's take a look at a couple examples. On average, if you're an OBGYN, you're going to have malpractice insurance premiums that range between $30,000 to $200,000 a year. If you're a typical family practice physician, you can expect your insurance premium rates to be somewhere between $8,000 to $30,000 per year. So now let's look at chiropractors. The typical chiropractor usually pays less than $2,000 a year on malpractice insurance. My malpractice insurance for this year is a whopping $736.61. If we compare that to the OBGYN, that's less than $1,000 versus $200,000. And this is not a slight to the OBGYNs. Their job is a much more dangerous job. While they're in the middle of working on one patient, that patient suddenly multiplies and there's now two. And because the risk of what they do is so high, their malpractice insurance rates are high right along with it. But if we look at the data, chiropractic is one of, if not the safest form of healthcare that's widely available to all people all over the world. There are several studies out there that have been done to test the efficacy and safety of chiropractic. And I thought about going into each one of these studies in depth and explain through research how chiropractic has been shown to be safe. And maybe I'll do that in another video. But what I thought would be best is to just look at the cold, hard data and have the data speak for itself. If chiropractic was actually dangerous, malpractice insurance rates for a chiropractor would be very, very high. But we have one of, if not the lowest, malpractice insurance premiums of all healthcare providers in the United States. And the reason for that is that chiropractic is safe and effective for people of all ages. Number 3, I can't go to the chiropractor because I had back surgery. One of the things that I hear a lot is, oh, I'd love to go to the chiropractor, but I had back surgery and my surgeon told me that I should never have anybody manipulate my spine ever. So what I say to them is that, first of all, the reason that your doctor said that to you is because they care about you and they want what's best for you. The problem is that when your surgeon says the word manipulate, they're thinking something that's very different than what actually goes on in a chiropractic office. After you've had back surgery, the last thing that you want is to have your spine twisted and turned and wrung out like a towel. And unfortunately, when your surgeon says manipulate, that's what they're thinking is happening. But that's just not the case. Now, I want to make this very clear. I'm speaking for Gonstead chiropractic technique specifically. First of all, the Gonstead chiropractor is going to work above and below whatever hardware may be in your spine. And anywhere they do adjust involves zero twisting and rotation. Those adjustments align and put proper motion into whatever segments needed to be adjusted without putting any unnecessary stress on the segments that have hardware or have had surgery. There's several studies out there that show that using chiropractic post-operatively or after surgery has been shown to increase recovery rates and increase quality of life. So should you avoid chiropractic if you've had back surgery? No, you should pursue chiropractic after you've had back surgery because it helps with your recovery rates and improvements in your quality of life. Number 2, once you go to the chiropractor once, you have to go the rest of your life. I hear this one a lot. And funny enough, I hear this mostly from people who've never been to a chiropractor themselves. The problem with this myth is that it's based on 2 faulty premises. The first one they usually say is that whatever problem you originally went in there for never gets fully fixed and they have you keep coming back forever. The second faulty premise is that you have to do something. You don't have to do anything. The best way to answer this is to look at dentistry. Chiropractic and dentistry have a lot of commonalities. Chiropractic and dentistry thrive in proactive prevention, but that doesn't mean that it can't be reactive. And also, like dentists, chiropractors want to see you periodically for regular maintenance. But a common response to that is that my dentist only wants to see me every 3 to 6 months. Why do you want to see me more than that? Well, let's take a look at a couple things. How many days a week do you set aside a dedicated amount of time to take care of your teeth? Hopefully 7. Now, out of those 7 days of the week, how many of those days do you dedicate a specific and dedicated amount of time to take care of your spine? Now, when I say taking care of your teeth, usually you think of brushing your teeth or flossing. But when I say taking care of your spine, a lot of people don't even know what that looks like. The reality is that if your spine was on your face, you'd take much better care of it. But because it's not, taking care of your spine is often neglected. Chiropractors on average see people once or twice a month for maintenance because it's much easier and much more affordable for the patient to stay well than it is to get well. In this study, they had this group of people who were under regular maintenance chiropractic care, and the other group of people were just going to the chiropractor as needed or whenever they got hurt. And what they found over a 12-month period was that the group that went as needed or whenever they got hurt, actually went to the chiropractor almost as much as the people who were on a regular maintenance program, but they had significantly more activity-limiting, painful days. One of the reasons that people are afraid or hesitant to be on a maintenance program is because they think, oh, I'm going to have to go a lot more and it's going to be a lot more money. But this research article and a lot of others show that being on a maintenance program actually doesn't increase the amount of times that you usually go to the chiropractor, because you decrease the likelihood of you getting injured or hurt. When you get injured and hurt, the frequency at which you need to be seen is a lot higher than if you're on a wellness or a maintenance program. So this other group who did choose to go onto a maintenance program, on average, saw the chiropractor less than 2 times more than this group who chose to only go when they got hurt. But the group that was in the maintenance program had far less days of actual debilitating pain that limited their activities or limited their work. Also, chiropractic doesn't add anything to the body or take anything away from it. So it's not like people can get addicted to chiropractic care like they can with pharmaceutical drugs. So no one is making you come back for maintenance care. If you want to only come back when you get injured or let things get to the point that you're going to need some serious work, we'll happily take care of you. But it's going to cost more money and take more time to do it this way than if you were to just have been on maintenance care. So even though you don't have to go for the rest of your life, I'd strongly recommend having chiropractic added to your regular healthcare routine for the benefit of yourself and for your family. Finally, the #1 most common chiropractic myth: chiropractic cures. The most common misconception about chiropractic is that chiropractic cures fill in the blank. Low back pain, neck pain, headaches, sciatica, allergies, anxiety, sleepless leg syndrome. It doesn't matter. If you talk to enough chiropractic patients over a long enough period of time, you're going to find out that almost every disease, illness, or injury has walked into a chiropractic office and at some point has walked out better or cured. My chiropractor helped with my back pain, mine helped with my neck pain, mine helped with my headaches, my anxiety, my insomnia, my digestive system, my Crohn's, my diverticulitis, my irritable bowel syndrome, my diabetes, my cholesterol, my hearing, my attention, my gallstones, my constipation, even my cancer. Some of these stories are so outlandish and crazy that they're really hard to believe. How does a nonverbal autistic child, after years of therapy and medications, finally say their first word after only having started chiropractic just a week ago? How does a colicky baby who's not responding to any other treatments or changes in their formula or diet finally stop crying after receiving specific chiropractic care? How does a teenager who originally went into a chiropractor for back pain realize they no longer need to take their anti-anxiety medication because their stress levels are basically gone? And how does an adult who's had high blood pressure for years suddenly realize that they need to go to their primary care to get their blood pressure medications lowered because after going to the chiropractor, their blood pressure started to regulate? The way to answer this is to go back to the principle on what chiropractic was founded on. Chiropractic is based on the vitalistic principle that the body is able to cure itself, so long as there's no interference in the mechanism by which the body is designed to implement that healing, namely the nervous system. Now, this is a topic that deserves a video all on its own, but I'll mention this pretty quickly. No chiropractor should ever be saying that they can cure anything, from back pain to cancer. Chiropractic does not cure anything. Your body does. We simply remove any interference that the body may be experiencing and simply allow the vitalistic, perfectly designed body to do what it was designed to do: to grow, adapt, and heal. Whenever there's an area in our body that needs healing, whether it be an injury, an illness, or a disease, that healing comes from the brain, down the spinal cord, and out the nerves to wherever that healing is needed. So if there's any interference in that pathway from the brain to the tissue, then that healing is going to be interfered with as well. So the chiropractor's only job is to find where that interference is and remove it through scientific and specific chiropractic adjustments. So does chiropractic cure anything? No. your body cures everything. Chiropractic is just about removing any interference or roadblocks to that healing. Whether it be pain, digestive issues, anxiety, depression, menstrual cramps, or whatever illness or ailment it is, chiropractors can take no credit in curing any of that. Your body is the ultimate doctor and it's designed to heal, grow, and adapt. So this has been the top 5 chiropractic myths. If you like this video, hit that like button, subscribe to my channel if you haven't already, and I hope you have a great day. So what do you want to say to all the people out there watching?